Hi everyone, here we are again, coming to you from New Mexico Wildlife Center. Today we are going to tour the hospital here at the New Mexico Wildlife Center. Just a quick background, we are a nonprofit organization located between Santa Fe, New Mexico and Espanola, New Mexico. And we are supported by grants and donations. So we sure appreciate all of you who support us. Thank you so much. In addition to our hospital, we have animal ambassadors, and normally we're open to the public Monday through Saturday, 9 to 4. At this time, of course, during the coronavirus pandemic, we are closed temporarily. We should be open soon. But the exciting thing today is that we are going to go behind the scenes where you normally cannot go because the hospital unit obviously is normally closed to the public. All right. So let's step inside the hospital and see what's going on today. It's kind of quiet around here since everybody's staying home. We're coming on into the treatment room and Hillary is here. Hi, Hillary.
Hello.
Hey, can you tell us a little bit about what happens here in the treatment room?
Sure. This is the treatment area. So anytime an injured or orphaned animal comes to our center, this is their very first stop. So this is where we can see what is wrong with the animal. We find out what injuries they may have, and based off of that injury depends on their path through rehabilitation. So here we've got some fluids to flush out wounds. We can also draw up fluids to give it to the animal subcutaneously.
Now, just like you would see in a human hospital, so you could do IV or subcutaneous if you needed to. Okay.
Exactly. Mm-hmm. This is where we keep all of our medications for the animals. They're different than human medications, and they're different from dog and cat medications. Wildlife are very specialized, and they require different dosages, and their bodies metabolize the drugs differently than other animals.
So how do you learn about what medications to give to different animals?
So we work with our vets very closely. They sort of guide us on special treatments for special cases. But we also have formularies that we go off of.
Like the book, right? Oh, here it is. I see it over on the shelf.
Yeah. So we've got a few here that we work with, and they say exotic animal, but it on top of exotic also means wild animals.
Fantastic. All right. Well, and what are some common medications that you use most often here?
So probably the most common medication is Medicam, and that is an anti-inflammatory and pain medicine for wildlife. It works sort of like ibuprofen in humans. Okay, fantastic. And I think we use a fair amount of antibiotics as well. Yes, we do have a bunch of different types of antibiotics for different types of wounds. So for a cat wound or a dog bite, we would use a specific antibiotic. And based off of what type of animal it is, we might have to switch to a different type just for that. And then bone infections are different, so we have medications for that too. And we also have all sorts of flea and tick and mite preventatives, because the animals that come in, we do have to be aware that they are probably carrying fleas and they probably have ticks and mites, which we don't want to spread to us and our pets, and we also don't want to spread it to the rest of the animals in the hospital.
Right, absolutely. And about how many animals did we treat last year?
We had close to 700 last year. We never broke 700, but we were very close. This year we are at 34 animals admitted in 2020.
And we're just about to go into the busy season, so we're gearing up for that, doing a little spring cleaning around here and making sure our shelves are well stocked and so forth. How many species, do you remember how many species we treated last year, different species?
Oh,
seems like it was 150 or 160.
It was close to that. Most of that songbirds made up most of that difference. So there's all sorts of songbirds that are native to New Mexico, including migratory birds that fly through New Mexico. So we have to think about those animals that come in as well.
Sure. Excellent. Well, thanks. Now, where would we go? Let's say you have an animal that's been treated and we need to perhaps do some surgical intervention. Where would we go next? Could you show us that way?
So if an animal needs radiographs, we do have an x-ray that we can take x-rays of the injury and see what's what's going on.
That's through here, yes.
It's right in here. Our surgery suite is just to the right. And this is where we can do surgery on site. Our volunteer veterinarians, whenever they're able to, they can come here and perform surgery on our patients. That saves us a lot of time and money and stress on the animal.
Sure.
So we don't have to transport them all the way to Santa Fe.
Yeah, that's good.
Yeah.
You know, I have to comment because I see that it looks like you're doing your spring cleaning in here. And I noticed that we have 2 autoclaves over there. It's time for us to give a shout out to a foundation that has provided us with some support this year. The Thaw Foundation in Santa Fe has given us a grant to do a bunch of remodeling here in the surgical suite, buy a new surgical table. And that new autoclave is the very first piece of equipment that we have purchased. So that's kind of nice.
On the left, the tan one. And then we are going to hopefully sell or salvage some parts of the old one.
The old one, that's the blue and black one on the right. So here we are with the surgery room.
Yes. So this is our surgery suite, and yeah, thanks to Thaw, we are gonna remodel this room and put up a lot of shelving and storage so that all of that bulk mess back in the corner there is gonna be organized and spread out.
Yeah, that's going to be neat. And we're going to be able to replace the old cabinets with brand new cabinets and stainless steel equipment. So it'll be fantastic.
Yes.
Terrific. So let's leave the surgery room. And can you tell us a little bit about the diets and how you prepare them? I see that we have a bunch of neatly organized food over here.
We do. So these are all of our dry goods. This is where we can go to specialized diets. Mm-hmm. For all the different types of animals that we get in. Like I was saying, we get in all sorts of songbird species, mm-hmm. and every single songbird is completely different from another, mm-hmm. So they require specialized diets. Mm-hmm. So we've got all sorts of different seeds over here. We also have, this is our mealworm containers and beetles. Ooh. So we are breeding our mealworms right now, so that we can cut back on some costs and make our own mealworms.
So that's for the insect eaters?
Yes.
Okay.
And it's really great for birds and other types of animals that eat insects to get live prey so that they can be stimulated, and that's what they're going to naturally be eating whenever they're released.
Terrific. All right. Well, fantastic, Hillary. I see that you have some work to do over there, laundry and some cleaning.
I do. During this virus outbreak, we are limiting people coming into the center. So unfortunately, that means that we have no volunteers. So I do have a lot of laundry to catch up on, lots of dishes, and a lot of cage cleaning to do.
Well, that's what happens. It goes along with the deal, huh?
It is an everyday task.
The glamorous part of the job. All right, well, while you're doing your cleaning out here, we're going to step into this patient room to my right. This is the Songbird Room, and I believe you said we had one patient in there right now?
We do. We've got a Eurasian collar dove in there.
Okay.
It has a fractured sort of wrist area. It's not at the joint, but it's like sort of like where this area would be on your hand.
Okay, fantastic. And I know we have to be very quiet when I go in there, so I'll be extra quiet, and we'll come back out as soon as we look around in the Songbird Room. Thanks, Hillary. So here's the Songbird Room, and I am going to lower my voice as I go in here. We're going to be quiet in here. So this is where we would put songbird enclosures for hospital cages. You can see we have some incubators or brooders for the sickest patients and the youngest ones. And a wonderful stack of towels, thanks to all the folks who have donated towels and pillowcases and washcloths. Converted a closet to have another space for putting hospital enclosures. You can see there's a bunch of hospital caging that has been cleaned and neatly stacked. And our collared dove is in here. I'm not sure if we can get a look. There she is. You can see she has a wing bandage on. Okay, we're gonna leave her we're going to let her continue to recover, and we will head back out into the main room. Speaking of donations, we have to thank the folks at Northside Veterinary Hospital, Dr. Heyman in Santa Fe, for donating all of these wonderful things here. A couple of stainless steel tables, a microscope, a dog scale, all sorts of stuff. We're just getting around to cataloging it all right now. All right, and Hillary, who's in this room over to my left?
So we have a raptor room, a songbird room, and a mammal room, but we do not have a reptile room. So mammal room is our reptile room for now. We have 2 tiger salamanders, and we have a patch-nosed snake in there, a mountain patch-nosed snake that was found with a small amount of scale injuries, but he's looking great and should be released back whenever it gets warmer in May.
All right. Well, we can go in there and have a look at them?
Yes.
All right. We'll be quiet, I promise.
Salamanders are probably hiding.
This is a board that Hillary and Haley use to map out the animals that are in outdoor enclosures and where they are, and it helps them keep track of who's where and who needs to be fed and so forth, and what enclosure still needs to be cleaned. So here we go into the mammal and reptile room. Again, you can see our incubators here for our sickest patients. And some of the clean enclosures. Let's go over here. Here's our little snake. We'll be extra quiet around him. One of our patients, a mountain patch-nosed snake, recovering here in the hospital at New Mexico Wildlife Center. And over here, we have our salamanders who are waiting for some warm weather to be released. And they are doing the salamander thing and hiding very well. These would be tiger salamanders. So that's an overview of the mammal room. Most of these enclosures, these cages, these kennels have been donated. And we sincerely appreciate all of you all who have donated to help us purchase those enclosures. I should mention here, New Mexico Wildlife Center, again, is a nonprofit organization. We're located between Espanola and Santa Fe, New Mexico. And here's Hillary, one of our rehabilitators. Hillary, anything else you'd like to add before I take the folks outside to look at our outdoor enclosures?
Well, we don't have very many animals out in the outdoor enclosures. Most of them have been released. We do have a dark-eyed junco, a house finch, we have a great horned owl, and our 4 bobcat kittens that are going to be released here in the next week. Very exciting. We've had them since last June. Yeah,
that is super exciting.
Yes.
Can't wait for them to get going. Have they grown quite a bit?
Oh yes, they've probably tripled in size.
Wow.
They came in as little kittens about this big, and now they're about the size of a medium dog.
Oh wow.
And they're very feisty, which is great. We don't want them to be nice to us. We want them to be afraid and able to survive on their own.
Right, so that is exciting. Well, I'm going to take everybody outside and we'll just take a peek at the outdoor enclosures so they can get an idea. Because what Hillary and I have been showing you right now here indoors is what we like to think of as the ICU. So if you think about it as a human hospital, this is the intensive care area where they would get surgery and have x-rays, have wound care, receive medications, and then before they are released, they go outside to what I like to call physical and occupational therapy, where they get to build up their muscles and their strength.
Yes.
Well, thanks for your time, Hillary. We really appreciate it.
Yeah.
We'll head outdoors. It's a beautiful day outside, and the sun is shining brightly. It makes it harder to see here. All right, so we'll head out here. You can see a few of our enclosures out this way. Weight enclosures are farther on past that. The largest flight enclosure we have is about a 100-foot flight enclosure. And then we have several other that are smaller than that, ranging from about 8 foot by 8 foot up to, as I said, that 100-foot enclosure. and the 100-foot is, I believe, 25 feet tall, something along those lines. We have a great setting here at New Mexico Wildlife Center. You can see behind us we All right. And I think we're going to wrap up here. I really appreciate your joining us today. We are New Mexico Wildlife Center. Again, we're usually open to the public Monday through Saturday, 9 to 4. But during this time of the coronavirus, we're closed. But we're still here and we're still caring for the animals, both of our patients and our ambassador animals on the education side of the grounds. Our hospital is open to the public in that we are accepting patients right now. So should you find an injured animal or an orphaned animal, please give us a call, 505-753-9505 if you're in New Mexico, and we will do our best to assist you. Again, we're a nonprofit organization. We sincerely appreciate all the support we receive. Thank you so much. Thanks for joining us here on Facebook Live, and we look forward to seeing you again out here for a visit when we're able to be open to the public again. Thanks so much, and have a wonderful afternoon.